are y'all folks here?
We're here on Tuesdays at the same time of the week.
SHOP, or Shelter Health Outreach Program, is an undergraduate group that was started a few years ago, and they at the time had wanted to engage with unhoused populations, predominantly in West Philadelphia, and they really had a unique vision around doing that in a way that promoted continuity and relationships between the student group and the individuals they were meeting in the community to develop those relationships, and then ideally try to bring health promotion and some simple health screenings into those sites.
It's been an amazing journey. Not only are the providers coming from SHOP, from Penn, but we also have the students that are coming and volunteering their time and helping out at the front desk and following up with patients and scheduling patients. But I think the biggest impact in this relationship is the outreach that these SHOP students are doing. They're going to shelter homes, they're going to churches, they're really bringing in that population that we are seeking to serve. People that are homeless, people that don't have insurance, people that suffer from food insecurities. These are the individuals that unfortunately don't have access to primary care. And from there, they're able to create that relationship with their primary care doctor.
We'll be right out.
So I think for us, the Projects for Progress grant was really essential to getting this off the ground. Through the grant, we were able to establish a fixed site location at Sean's in West Philadelphia, and also through the grant, we were able to begin having our mobile clinics at all our sites throughout Philadelphia. So that really allowed us to help Penn Medicine realize that this is a sustainable and a very much necessary component of care in the community.
There's a very large group of people in the Philadelphia area that are eligible for health insurance, but they don't know how to get it, or they're not eligible for various reasons and they need the free health care. So places like Shams that are very low barrier really helps fill that need and that gap in healthcare services that exists in this area.
Oftentimes these individuals don't have a phone or laptop. They can't Google free clinic in West Philadelphia. So they almost need somebody from us to go to them and be like, hey, we have a free clinic. When's the last time you had your blood pressure checked? And most of the time they're gonna say never or years ago, and they probably don't even remember. Having that opportunity for these SHOP students to be in those locations where these individuals are, it's been huge.
Press on my finger here, and press on here.
So one thing our club is really trying to do this year is build more trust with all the guests at our sites and guide them towards our clinics, provide more social services, and really give volunteers the opportunity to become more involved so that they better understand these needs as well.
One of the other big impacts from this SHOP relationship has been just having a consistent presence, the same doctor week in and week out for these patients. Again, continuity of care, especially with this population, is super critical in terms of seeking the outcomes and improving the health of these individuals ultimately. So when they come in and they know they're going to be seeing Zach or Dr. Teal or whoever it might be, they build that trust with these individuals.
As we move forward, I think there's a strong commitment on the university side, at many levels, to make sure we can provide value, provide access, and really continue to try to reshape and reframe our relationship with the community. How can we take the resources of the university, of our health system, and find access points that are lacking care and lacking providers, find out what they need, and then fill the gap?